Live from the Cactus Creek at Ibri, he is the king of prime time, Ghana's undisputed entertainment laureate, and still the youngest old man in Ghana. Put your hands together, show some love for the indefatigable KSM.
The KSM Show.
Welcome again to the Cactus Creek, the home of serenity, man. Cactus Creek, they're not serenity, man. Give it up, man. And also to let you know that Vanguard Assurance is proudly associated with this show. Man, one more time. Yes, but my guest today, man, it's a young lady, fascinating. I'm telling you, when I say fascinating, I do mean fascinating. She's a medical doctor. She's visiting Ghana right now, and she's with the Luka Hospital. We're talking about that a little bit, but very brilliant woman. I want to introduce her now. And when she comes and we start talking, you start understanding why I'm in awe of this young Ghanaian lady who's a doctor and an associate professor at the University of San Francisco. Show some love, man. So with all the love and vim that you have, show some love for Dr. Jessica Opoku-Anane. Hey, good to see you. Please. Oh, wow. She's in the house. We're going to have a nice talk, and I'm telling you, get ready to be impressed. We're going to take a short commercial break. When we come back, the doctor is in the house. We'll be right back.
The KSM Show.
Let me start this way, man. This is a special big up and shout out to Mr. Ruben Akpeke. I hear you're always tuned into the program. Thank you very much, and big up to you. I hear you're staying at Amposa Estates on the Dodo Road. One more time, big up to Mr. Akpeke. I'm very, very happy to announce all those who texted the correct answers to the Binaton giveaways. We have called them and we have given them their prizes. Prices for now. Next week, a new set of questions. So tune in. Binatone, simply better. Well, last week I talked about the FTB special, the first-time buyers. All those who are buying cars for the first time, I told you to make sure you insure with Vanguard. Guess what? The response was so good, so they're extending it. So now it's FTB, not for only cars, but homes as well. So if you're buying a home for the first time, make sure you are insuring it with Vanguard Assurance. And the numbers are 055-662-0111 and 024-433-4407. Call them, get the Vanguard experience, and you will understand why they say, we always stand by you. At Cactus Creek, the Sunday specials are still running. Amazing locals, TZ and fufu with gold light soup. Stop by on Sunday and have a great lunch.
The KSM Show.
Hey. Folks, you've been watching this show for the last, 19, 20 years maybe. Have you ever seen me go on set with a laptop? No. But I'm sorry, man. I'm sorry. This lady here is so impressive. Upon it be her, I had to bring my laptop so I don't forget. So forgive me. Show some love, man. Well, I told you in the beginning we are talking with Dr. Jessica Opoku-Anane, and she's an MD, MS, and there's some abbreviation I had to go to Google to find out what it means. It says she's FACOG. FACOG. And I'm saying, Google, what does this mean? So I went to check it, and it stands for Fellow of the American Congress of obstetricians and gynecologists, man. Show some love, man. And I'm telling you, it also told me that when you are made a fellow, it means you offer health service of the highest quality. Oh, not yours, I know. Show some love one more time. Jessica, welcome to the show.
Thank you. Thank you.
My
for
daughter
having
told
me.
me about you. You'll be coming to Ghana. I says, when you get here, I have to talk to you. So I'm glad you're here, and I'm glad I'm talking to you.
I'm glad to be
Because
here.
you have a very impressive background. Were you born in the States?
Yes, I was born in the States,
You were born in the States, yeah?
Washington, D.C.
You feel like you're an American or a Ghanaian born in the States?
I feel like a Ghanaian American.
You feel like a Ghanaian American?
Yes.
Show some love, man.
Both parts have a role.
They both have a role.
Yes.
Fantastic. There's so much stuff here, man. It's so impressive. And I'm sorry if I'm overwhelmed, but I want my audience to know who I'm talking to get a better picture of who you are. So when we start talking about what you're doing in Ghana, it will make more sense, yeah? But you have some pretty amazing things under your belt, you know, because what I know is when they call you a fellow simply means in English, it means very impressive person.
Yes.
Can you say it?
No.
No.
Not on television.
But I was checking, you know, and I see that you're a solo of the American Association of Laparosonic Surgery, right? Also, the American Society of Reproductive Medicine, also fellowship in minimally invasive gynecological surgery.
Yeah.
All of these you're a fellow in. Wow. That's fantastic. You look very young. Why
Am
did you
I?
study all of these things?
I'm 40. Is that young?
You're 40? Still very young.
I don't feel young.
You look younger than, I would have put you at 32.
32. That's not bad.
So that's really, really impressive. Tell me a little bit about your educational background, when you got into medical school, and how you said all these aspects of medicine.
I did my medical school training at Johns Hopkins in Baltimore. I grew up in the Maryland area, so I went close to home. And then I did my residency training in obstetrics and gynecology at the Harvard program, the Brigham Women's and Massachusetts General Hospitals. And then after that, I did the fellowship in minimally invasive surgery to learn how to do same-day surgery through tiny incisions. That's better for patients. So that was 2 years at George Washington University. And then I started my position that I'm in now at the University of California, San Francisco for the last 6 years.
Wow. And you're also an associate professor?
Yes, so it's a teaching position. And I just got promoted to associate professor there too. And I direct our division of minimally invasive surgery.
How often do you come to Ghana?
Usually once a year, but this time it's going to be 3 times in the year.
Oh, you've been here 3 times already.
Twice, but I'll come back in December.
You're coming back in December.
Yeah, you know,
Yeah.
December is a fun time.
So tell me this. You're now stationed with Luca Health.
Yes,
When I was introducing, I said Luca Hospital. No, it's Luca Health.
yes.
Yeah, okay. And there's something about that I want you to explain in terms of doing non-invasive surgery. Is that?
Yes, I think one thing that's really distinctive about Luca Health is they're able to provide minimally invasive surgery, which is same-day surgery. So instead of using a really big incision, either below at the belly or up and down on the belly, we do all of the surgeries using tiny keyhole incisions. And it's kind of funny in Ghana that people are very wary of this, but this is the standard of care in Europe and in the United States because it allows you to have safer surgery. So patients have less pain, less bleeding, less infections. They go home the same day, and they're back to their normal lives in a very short amount of time.
Let me go through this again. You have the regular surgery where they make incisions in you, and then they cut you up and they do all of that stuff. That's not what you do.
No.
You're doing Minimal, non-invasive surgery.
Non-invasive surgery. Sometimes
Okay.
there's not even an incision. We use natural openings to do the surgery.
What I'm trying to get at is, you're saying that this is, Ghanaians don't really understand this?
No, actually, sometimes people will think that we're doing something bad or that it's not safe, and it's completely safe because you're going home the same day. But the point is that you can, because there's less pain and there's less scar tissue, less complications. And so the reason why we send you home is because you're fine. You know, you don't need pain medications, you're eating, you're walking, you're going back to your normal life. So that's why we're able to offer those services. And it's because of the extra training and ability of surgical ability of our surgeons to be able to offer that.
It's quite interesting, you know, that you go to hospital and they say you have to have surgery. And they are using surgery, but they don't really cut you up. So
Yes.
there's not that much pain.
Yes.
And most of the times you can go home the same day and continue with life. And it's like people are not used to that.
They're not used to it. And it's, you know, the difference could be recovering, your whole time of recovery being 2 weeks compared to when you use the big incisions, 6 weeks. So it's a big difference in how you will feel after surgery.
Why do you think that people are hesitant? Because this is big in the US. You know?
Very big.
Yeah. And
Yeah.
people request to have minimal, non-invasive surgery.
They demand to have minimally invasive surgery, and
Yes.
they come to, you know, my institution is very big, and other institutions, they come to us specifically for these type of
For
surgeries.
these types.
Yes.
Yeah.
But I think it's new here. People don't know about it. Even other doctors may not know much about it. So if patients ask them, they cannot tell them the benefits of it over traditional surgery.
And folks, the reason I'm going on and on about this is that it is like the new thing, if you will, in surgery. You know, to speak to you a little bit here. First again, if you chow too much, there's not the bleeding. Yeah, operation, operational, very minimal. Sometimes they just use things to, like.
Yes, we pass our long instruments through the tiny incisions, and we just control them from the outside.
From outside. And they do the surgery. Yeah. But before we continue, I want to just join me. Let's go for a little tour, maybe just 60 seconds or 90 seconds to their setup, right? Look at Health. I want you to get a sense of the equipment, a sense of the place and what they do. And then when we come back, we'll continue. Man, did you see that? I mean, it's fantastic. I'm still here with Jessica, and we are talking about this. And what areas do you cover?
So I cover gynecology.
Gynecology.
Yes. There are 6 different services there, but my area is gynecology. And we offer many different things. The most common here in Ghana, the most common things that we see are fibroids, irregular bleeding, and something called endometriosis that can cause really painful periods and just chronic pain in general. And both the fibroids and endometriosis often cause problems with infertility. So those are probably the three biggest things: fibroids, endometriosis, and infertility. But we do a full spectrum of gynecologic care.
Let's stick with fibroid for a while, because fibroid is big in Ghana.
Very big.
Very, very big in Ghana.
Yes.
For those ladies out there who are experiencing what I'm talking about, you know what I'm talking about. For ladies with fibroid who visit Luca Health, you know, so are you telling them that they shouldn't expect that kind of surgery you're still able to do with minimal invasive?
Yes, not all patients can have the minimally invasive surgery, but many people can. And if actually in Ghana, I would wish that patients came earlier, when they can have a very simple, easy surgery.
If they come early.
If they come early. It depends on how big the fibroids are and how many there are. But the setup, I've been to many different hospitals in Ghana. The setup of Luca Health is the one that I feel the most comfortable operating in, and where we have really great anesthesia and we have really good ORs, very good ORs, and all of the equipment that we're using in the United States to do the surgery.
In the time that you've been to Ghana, with your relationship with patients right now, are there any big differences between your patients from Ghana and those in the U.S.? And what are the differences?
Patients here do not tell you directly exactly what they're here for.
They don't tell you what they're here for?
No, you just have to talk to them about their families and their stories, and then you find out, oh, she's here because she has a problem in the bedroom with her husband. Okay, that's what we're talking about today. So you have to ask more questions. I think in the United States, the patients are encouraged to ask questions, to question the doctor. Here, people don't question you as much. So you have to kind of pull things from patients. Also, what you see is very bad. By the time it comes, you know, in the United States, we would have done something about it much sooner. So you have to be more creative to do things. One day, I was doing a surgery I do all the time in the United States. It's a complicated surgery. And I was in there and I thought, you know, Ghana, I don't know about the blood bank, how much blood is available. So I had to do another procedure to stop the bleeding that I wouldn't normally have to do in the United States, because there's so many resources. Someone can bleed all their blood and we can replace it in the United States, and it's not a big deal. So those are some of the differences.
So basically, if that happens in Ghana, you're in big trouble.
You're in big trouble.
Yeah. So
you have to be more creative, and I think I'm very thankful for my training. I've been many different places, mostly referral centers, because you have to be very quick on your feet to figure out different ways to do things.
So the key thing there is early detection?
Yes.
Does it have symptoms like for fibroid? Do you have early symptoms that you know that I'm developing fibroid, or it always comes when it's too late to do anything about it?
Yes, heavy periods is one of the bigger signs, depending on where the fibroid is located. But also, we call them bulk symptoms. So you feel pressure from the fibroid. Maybe it's pushing on your bladders, and then you have to urinate a lot. Or it's pushing on your bowels, so you feel constipated. Or if you feel a mass, if you can feel something hard in your belly, it's probably a fibroid, because they're very, very common. And then sometimes women will come because it affects pregnancy, the ability to get pregnant.
Many women are scared of in Ghana is fibroid and pregnancy, that whole bit, that if you have fibroid, it can affect your pregnancy, or if they take your fibroids out, that's a threat to your reproductive health and things. How true are these things?
Well, it's true. Well, 80% of women of African descent have fibroids, so it's very common. But most of those women are having babies, so not everybody who has a fibroid will have a problem getting pregnant in the future. But if it grows in the wrong place, that's when it affects fertility. If it starts to grow inside the womb, where the space where a baby would develop, that's when it causes problems. It can lead to miscarriage, or it can lead to breech baby, because there's not enough room for the baby to come down head first, or it can prevent a pregnancy from happening, because there's not space for the pregnancy to implant into the womb. So yes, it can affect fertility, but it doesn't always affect fertility.
So when you have a situation and it's affecting fertility,
yes,
can you do something through surgery to
you can.
to correct it?
You can remove the fibroids, and actually this is a time where the minimally invasive laparoscopic surgery is better because you're less likely to develop scar tissue. And sometimes when you do the big incisions up and down to remove the fibroids, you get scar tissue around the fallopian tubes, and then that can lead to infertility. So I do a lot of surgery for fertility doctors in the United States. We always prefer to do the minimally invasive approach over the other one for these reasons, because there's less scar tissue, and also because the woman recovers faster, so they can go back to trying to get pregnant faster.
Yeah, folks, it's getting very, very interesting. We're going to go into a commercial break. When I come back, I want to ask about, is there something like, if you had come earlier, we could have saved you? Is there screening processes that we need to go through? All these things are very, very important questions that I'm sure many, many, many ladies out there would want to know about. So let's take a commercial break. When we come back, we shall find out about these things. Stick around, we'll be right back.
The KSM Show.
Okay, at Cactus Creek, the Sunday specials are still running. Amazing locals, TZ and fufu with gold light soup. Stop by on Sunday and have a great lunch. Well, last week I talked about the FTB special, the first-time buyers, all those who are buying cars for the first time. I told you to make sure you insure with Vanguard. Guess what? The response was so good, so they're extending it. So now it's FTB, not for only cars, but homes as well. So if you're buying a home for the first time, make sure you are insuring it with Vanguard Assurance. And the numbers are 055 662 0111 and 024 433 4407. Call them, get the Vanguard experience, and you will understand why they say we always stand by you. I'm very, very happy to announce all those who texted the correct answers to the Binatone giveaways. We have called them and we have given them their prizes. We're giving away all the prizes for now. Next week, a new set of questions. So tune in. Binatone, simply better.
The KSM Show.
One thing that is very, very vital, folks, is screening. Call and go and get screened, because when it gets screened, things are detected early, and that's your salvation. What's your reaction? Are you getting people really doing the screening?
We do occasionally get people doing the screening, but by far people are not screening enough in Ghana.
They're not screening enough.
Not enough. There are many cancers that we can pick up very early before we call them precancers, before it turns into a cancer. Because many cancers take many years before it develops into a cancer. If you come in for your screening, we can remove the precancer cells, or we can treat it and prevent it from developing into a cancer. But oftentimes we don't get patients coming in for the routine pap smears or breast mammogram screenings or prostate screenings or any of the many things that in the United States we routinely do on a regular basis.
The thing that I found fascinating about the Lucas setup is this non-invasive surgery thing, and what I find fascinating is the fact that people shy away a bit from it.
Yes,
I think it's so unfortunate.
It's so strange to me. Our patients, in the United States, is social media. So they have whole websites of who does minimally invasive surgery, and they go find you directly, and your wait lists are so long for this minimally invasive surgery. And here people are nervous to get it. So when we're in Ghana, a lot of the patients we have are expats, foreigners, because they know about it and they will come to do it. But I really wish that it was more Ghanaians who are getting the services.
Well, maybe also because it's very new in Ghana.
Yes.
It's just like starting off, and people always resist very, very new things. But I really have a feeling that if people begin to understand
It's better.
how much better it is,
Yes.
I think minds will start changing, because it beats me.
And it's not new. It's been here since 1970s, even before that, but established since the 1970s. So it's a very old technique, but it's just new to Ghana.
It's new to Ghana.
Yeah.
Do you find that the medical institutions themselves do not encourage it?
Yes. It costs more money for like Luca Health to, or some place, there are a few places in Accra that are doing it. It costs more money for them to set up to do these procedures. The instruments cost more. The setup takes more. So the hospitals have to invest in the equipment. In the end, they will get back their money, but if they're not willing to put investment in there to get the equipment, then it's hard for them to develop a program. So I've actually done laparoscopy, this minimally invasive surgery in Uganda and Ghana and Senegal and in different places. So oftentimes people will wait for donations. Those programs never work because the equipment will break, then they have to wait for somebody to come from Europe or something. Those don't work. The hospital has to invest in a full program and the right anesthesiologist, and because it's much more general anesthesia where you have to be fully asleep than the spinal anesthesia that they like to do a lot here where you are awake. So it's a full investment of a program to do it. So unless it's like a Luca Health or some of these other places that are doing it all the time, it's really hard to get it started.
For people listening out there, I am really appealing to you to go for your screening.
Yeah.
You know, I don't know whether it's a money issue. What are the costs like? You know, how intimidating such beautiful, wonderful equipment can look. Hey, but all these things, it translates into then there must be very, very high costs here.
Yeah, well, a lot of people are flying out to go get these surgeries. So it's much, much cheaper than all the people flying out to get the same thing. And it's much cheaper than what we charge in the United States or in Europe. Some of these things are not expensive at all. And if you get this one, you prevent the need to have a much bigger surgery in the future that's going to cost more money or lead to more consequences as well.
Cool. Now we've done enough medical stuff. It's nothing like enough medical stuff, but you know, let's get to know a little bit more about Doc here. Do you ever intend relocating to Ghana?
Yes, I would. So I'm Ghanaian American. I like just that balance. I'm looking for a 50-50.
50-50
split. Yes. So part of me coming all the time, working all these institutions, is to look at.
So you're checking it out.
Yes, how things work, where are their needs, what's being done well, what's not being done well, where can I be helpful and useful. So it's helpful for me to keep coming because I think it's a mistake if we just take everything from the U.S. and try to do it in Ghana. It won't work. So I learn to, while I'm here, by just watching what happens. But I intend to, maybe in the next 2 years, to figure out a 50-50 split.
And this is an absolutely silly question, but would you rather have an American husband or a Ghanaian one? I promise you.
I'd rather have a westernized Ghanaian.
Oh, I see.
That's what I'll say about
Any
that.
westernized Ghanaians in the house?
So that he can relate to me, because I'm very westernized. So
You're very westernized, so you need somebody who can relate to you.
Yes. Yes.
And you prefer a Ghanaian who's westernized than a Western person?
Somehow, I've been trying to date other people and it's not working out. So
it's not working out?
No, I don't know why. It doesn't work. It's always these Ghanaian guys. I don't know. So I guess that's what I prefer.
So there's been more Ghanaian guys than...
Yes.
Really? What is it? What doesn't it make it work out? They are too Ghanaian. They don't understand a little bit of the Western thing. Because if you're meeting them in the U.S., I would suppose that at least they have been exposed to the U.S. a little bit.
I was talking to your wife about this one.
What was her advice? She's a general counselor, you know.
Sometimes when you are, I work a lot. I have a lot of things going on and a lot of accomplishments. It can be difficult if the man is a bit insecure. And, there are a lot of egos. Yes.
Yeah?
That's what I would say.
Really? I'm trying to understand it. I mean, like why? Because you're not home.
Yeah, maybe
Baking-
I'm working late, or uh, I'm not the person who you have to. I've always said to myself, you have to at least be able to cook rice. You cannot. If I have to cook on the weekends, I'm not cooking during the week at all because I'm busy. So you have to at least be able to boil yam, cook rice, something,
The basics.
and feed yourself. I cannot be your source of all nutrition all the time. So those type of things I think it's unreasonable to expect a woman to have a full-fledged job,
Yeah.
and then also be a
Come-
full-fledged mom, and then
Yeah.
also be a full-fledged cook and a cleaner. You have to work with her a little bit. I'm not against any of those things, but I think you have to work with her and be supportive, be okay with having help, so that she can be happy. Because if she's happy, she will do a lot of things for you as well.
And yeah. and Ghanaian men out there, this to me, this to me sounds very reasonable. I mean, it's not like we are back in those days where women were sitting home when men were out there farming and all that. It's moved.
It's true.
It's moved. So
True.
I'm even surprised that women will be still encountering men
Yes.
like this who say no.
It's true. Actually, sometimes the westernized Ghanaian guys are the worst because they want to pick and choose what they like. So they want a traditional woman who also makes a lot of money and brings a lot of money home and is working all the time. And I keep saying that's basically, you want the woman to have 2 full-time jobs, but how can she do that? So
What do you have? Find a non-westernized Ghanaian man,
yeah.
probably doesn't even have a passport, but understands and can relate to you,
Yes.
and share things. And this man has not even been to Togo. He's with the program,
No, I'm open.
You're open. Yeah. Ghanaian men. No, honestly, because of course, and I'm sure you know, you're very, very attractive, extremely brilliant. Maybe that may be the part that threatens a little bit, because you're a fellow of the Association of the Congress, some big time things like this.
Yeah. Well, I mean, it's not me though. I don't go saying I'm any of those. Before you read my CV, you had met me a few times. Did you know any of those things? Yeah, I don't go announcing those things for everybody to know that. But I think sometimes, even if the woman is not, doesn't have an ego or something, men are men. Sometimes they can handle it or they can't handle it. I cannot make them secure. They have to just already be secure.
What's the worst type you ever encountered?
Of men?
Yeah,
Sexist men.
sexist.
Yeah, I don't like sexist men. Men that think I should just quit my job and go follow them all over the world. Like, no, I'm not going to do that.
Yeah, I hear you. Oh, wow. So it's like in Ghana, the politicians call it the pipeline, things that are there. Are there any men in the pipeline, either in Ghana or in the U.S.?
They are there.
They are there
Yes,
in the pipeline.
in the pipeline.
Jessica, I'm just having fun with you, just
Yeah.
messing with you a bit, But on the very serious tip, you've done extremely well. And I know you don't go announcing anything, but I had to study this a little bit. I'm like, wow, that's a very, 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 very brilliant person. You've done lots of work studying, So congratulations.
Thank you.
And I hope that they say we used to have the brain drain. All the Ghanaians took their
Yes.
brains away. Now we're looking for a brain gain to get you all back.
Yes,
you
I
know.
hope when I build whatever I'm going to build in the future that people will come and receive me well.
And for those of you who are listening, she's back here for the last few months. She's been working at Luca Health Facility, and we'll show you more of the tour of the Luca thing, the virtual tour. But please call them and check up. And I'm recommending Luca Health because you saw the setup. Okay. So is there a number people can call and reach if they want to come and do a pre-screening At least let's put the number out there for all those
Yes.
who have. Yeah.
The number is 054-412-0777.
Okay. And folks, you can see the number on your screen right now. Ladies, dial this number, man. Make an appointment and go and check it out. And then be healthy. The earlier it's detected, the better it is for you. Jessica, thank you so much
Thank you.
for joining us. And congratulations again. And hopefully we can get again and bring you back. I promise you, we'll get one Ghanaian part to blow your mind and eh?
I'm waiting.
You're waiting.
I'm waiting.
So Ghanaians, man, she's waiting. Oh, those of you who can understand and respect that you can't put her in a box.
Amen.
Thank you very much. We'll come your way again next week, but until then, what do I say? I am out of. Let all the crew say, yeah.
The KSM Show.